Hello and welcome to the latest episode of the Health Wrap by The Hindu. This week we discuss India's fertility rate sharply falling after decades of growth and the implications of this for the future. We also look at the many unseen facets of antimicrobial resistance and something we simply couldn't ignore, the impact of GST rationalization for the healthcare industry. Do remember to stay on for our experts segment where Dr. Lakshmi Vijayakumar, founder Sneha, brings attention to the youth and mental health. Also, A.S. Jayanth, our reporter in Kerala, dials in to talk about the challenges of covering the Amoebic Meningoencephalitis cases in the state. So, Zubeda, let's start with the most important story of the week, which is this week the falling fertility rate in India. So, the sample registration survey data from last week shows that the fertility rate in India, which has been following in a number of states, has dropped below the replacement level. It has come down to 1.9 and several states in the country have also had a falling fertility rate. So, this is something that will have implications for our future. It will have implications for our policy, it will have implications for healthcare as well.
Yes, Ramya, as you said, 1.9, which is below the fertility replacement level of 2.1, and 18 states and union territories have already achieved this. Of course, there are regional disparities. Some states continue to have a higher rate, but the path is clear. The population is shrinking as it is continuing to age as well. And you said this is going to have a lot of healthcare implications, especially in terms of what we can do for geriatric care.
Right. So, the thing that we have to keep in mind is that we still are a large country. We are the most populous country in the world. And so, while this demographic transition is happening and must be acknowledged, this doesn't mean that we will dramatically change tomorrow. The game will continue, our rates will continue to fall. We are not in a crisis situation as yet. With the TFR, the total fertility rate coming down, there will be implications in terms of a growing aged senior population. And what we must do is to ensure that the needs of this senior population are taken care of, and this will require vast and sweeping reforms in the health sector.
Yes, as a number of stories on our website have noted of late, geriatrics is becoming increasingly important, but is it being given the importance at a policy level, at a medical curriculum level? You can check into our website for a lot of stories on this, as we recently published in our ebook as well.
Yeah, we had an ebook, Shades of Grey, which spoke about the multiple aspects of a greying nation. And we spoke about senior living, long-term facilities, a question of loneliness, how does aging fare with reference to women, and a lot of aids and appliances that can come in handy as well. Remember to check out our ebook on the website.
Absolutely, and this is something that should be urgently tackled. Moving on to the other big story that we've had this week, and that has been on something that we've discussed before as well, which is AMR, antimicrobial resistance, something that has become a global public health threat at the moment. An interesting story we had this week, which you can log on to our website and check out, is the link between AMR, or the overuse of antibiotics, and mental health.
As research progresses into AMR, now nations across the world are really conscious of AMR and the need to keep the numbers down and to keep the resistance levels low, because then if people are resistant to develop highly resistant strains of bacterial infections, then cure is next to impossible as it is now. Of course, certain new antibiotics are in the pipeline, and we've discussed that before in the health wrap. But talking about antimicrobial resistance and the stories we've carried this week, there have been a lot of new findings in the area, particularly linking the gut and mental health and antimicrobial resistance. And we've also looked at rise of sexually transmitted infections. So these are emerging paradigms, and the more we research, we're going to be able to find many more such connects that we didn't know existed in the past. So it is very, very crucial that AMR, or antimicrobial resistance, is tackled immediately and intensively by governments across the world, private and public hospitals.
Yes, as you were saying, Ramya, it becomes increasingly clear that what you put in your stomach is going to directly affect your brain. And from there, let's move on to something else to do with the brain, which is that Kerala is now being ravaged by amoebic meningoencephalitis, something that has seen a number of deaths this year and a record number of cases as well. And to speak to us about this today and to tell us what's going on the ground, we have with us today our special correspondent A.S. Jayant from Kerala. Hi, Jayant. Welcome to the Reporter on Call segment of the Health Wrap.
Hi, Zubeda.
So, Jayant, you've been covering the PAM crisis in Kerala, the amoebic meningoencephalitis infections that have been spreading across the state. Could you tell us about your experiences in covering this?
Actually, this is not the first time in the past 2-3 years that the state has been recording these infections. According to health sources, Kerala started reporting these cases frequently since 2015-16. Till 2023, most of those who had these infections, they succumbed to their infection. They died because they were taken to the hospital only at the last stage. As you know, there's a rapid onset and the patient dies. The infection spreads very fast. And most of these patients were kids. They have had some kind of interaction with unhygienic water sources in some way or the other. So after 2023, what the health department did was that they tried to bring in a protocol. They tried to bring in a protocol for the diagnosis as well as for the management of the infection. It helped in detecting these cases very faster. So in the past 2 years, there have been many cases. Between 2023 and 2025. As you said, regularly cases have been reported, mainly from the southern side, Trivandrum, Thiruvananthapuram, and the northern districts, Malappuram, Kozhikode, Palakkad, and Wayanad districts. This year, actually, in August second week, one child died of encephalitis. That was a first reported case in recent months. Actually, one 8-year-old girl. She was from Kozhikode. She died before she was taken to the medical college hospital. She had some fever and other complications one day. Next day, she was taken to the Taluk hospital. The same day, she died by the evening when she was rushed to the medical college hospital. Thereafter, some of her siblings also started exhibiting symptoms, and some other cases also reported from the medical college hospital. The health department started taking notice of the infections in a much serious way, as you can say.
Thanks, Jayant. What are the challenges that you have faced as a reporter while doing this story?
Actually, I wouldn't say they're challenges, but some kind of occupational hazards, we can say. We have two directorates here, the Directorate of Health Services as well as the Directorate of Medical Education. These medical college hospitals come under the DME, Directorate of Medical Education, and the other health facilities, hospitals and all come under the DHS, Directorate of Health Services. So when you want to get the information from the medical college, the people in the DMO office, they may not be able to help because they are in a separate department. And when you want to get information from that, even the DME, if the hospital has 2-3 departments, one department may not be able to give the information about the patients in the other department. And there are different units also. So what we are doing is we need to cross-check with multiple sources. Like you need to talk to the district surveillance officer, district medical officer, mass media officer in the health department. Then that particular department in the medical college hospital, the doctors there, and cross-check and verify the information at the same time. Like they'll say, for example, in the Kozhikode Medical College Hospital, you have a pediatrics department. That's a separate block. So children are admitted there, and the adults are admitted in another department. So you need to talk to both the general medicine department as well as the pediatrics department to get the information about these two types of patients. and again with the DMO's office or the DHS to get the overall picture. And sometimes, like in the recent cases, some of these patients were not from Kozhikode, but they were admitted to the Kozhikode Medical College Hospital because it is the biggest public healthcare institution in this part of the state. So, for example, if a person is getting admitted from Wayanad, you may have to talk to the Wayanad DMO first, and then you have to talk to the Medical College Hospital to confirm that he or she is admitted there. So that way, you need to be in touch with multiple sources just to cross check and verify the whether
Understood.
yeah.
Understood. That sounds like a lot of logistics to take care of.
Yeah,
Tell us,
yeah.
Jayant, what is the health department's advisory when it comes to using public water bodies? Have they issued any sort of public health message with regard to this?
Yeah, actually, in August, the health department issued an advisory in separate districts. Initially in Kozhikode, then in Palakkad, then in Malappuram and Wayanad. 3-4 districts were covered because most of these cases from these districts. And in August last week, August 30 and 31st, a massive cleanliness drive was launched in association with the Harida Kerala and Sujita Kerala mission. All these public water sources like ponds and wells and all these, they were chlorinated and in association with various departments and residents associations. And awareness sessions were conducted in multiple places. Actually, the thing is that many people are not aware of this presence of this amoeba, though doctors say it's all ubiquitous, it's all pervasive. No, not only Megleria fowleri, the other 3, 4, 5 species of amoeba are also prevalent, seen in Kerala's atmosphere, in soil and water bodies. So what the health department is saying is that you need to ensure that your water bodies are clean always. Like chlorination is the best practice that they are advising. Along with like ensuring that your water source, water that you're using is hygienic.
Right. Thank you so much for speaking to us today, Jayant.
Yeah, thank you.
Thank you, Jen, for coming on call and letting us know about the challenges in covering this outbreak. We remember that Kerala had a similar outbreak even earlier. Thank you so much for coming in.
The other big story this week, Ramya, has been about GST and the implications it's had on the healthcare sector.
Yeah, that's true. The GST restructuring rationalization exercise has huge implications for healthcare, and I think as a policy, it is the first time that the country is actually advancing its attempt to provide universal healthcare access for all. The welcome move is that it has completely removed the 18% GST on health insurance policies, which is wonderful. So, families will be paying much less when they take health insurance policies. The other thing is reducing, in fact, removing the GST for some cancer drugs, life-saving drugs, including for rare diseases. Patients will benefit a huge lot from this. The other thing is also reducing the rates on certain medical devices and medical services. In fact, the rents for room rents for hospital stays has also been completely removed for the lower slab. It is only when you move into the premium segment that GST of about 5% weighs in. So, I think as healthcare move, this is phenomenal for the health sector. More people will now be able to access critical healthcare services, more people will be able to afford treatment, and overall I think this is a wonderful thing for healthcare in India.
Absolutely, Ramya. As you said, it makes care more affordable and accessible to a whole lot of people, and the removal of insurance premiums, which has been a long pending demand, has also been a welcome move. There are a couple of concerns though that public health activists have pointed to. One is that a lot of sugary, calorie-rich food has been moved from one GST bracket to another, making it a little cheaper. And this is of concern because our food labeling laws in this country continue to be weak, which means that consumers may not know what they are picking up at the supermarket and eating. And the other part of it is, of course, the BDs. While BDs have become cheaper now under the new GST rationalization, public health activists say that this could increase the problems that we are facing with our tobacco epidemic.
Yeah, Zubeda, these are two critical points that we must raise as concerns of the people and of the industry as such. First, let's talk about the, making packaged foods affordable, sugary foods affordable. I think that's something that will affect this country over the longer term, because packaged foods, processed foods, sugary drinks, these sort of add calories to your system, and consumption of these foods clearly lead to many non-communicable diseases. We know that we have an epidemic of diabetes in this country. We have the highest load of number of diabetics in this country, and it is also important because these contain highly processed salts and sugars, and this we also have high numbers of hypertensives in this country, and looking at cancers, that's another thing. So I think this is not a great move, and it is very clear from data from the West that pricing these packaged foods low leads to an epidemic in non-communicable diseases. I think we should not ignore the writing on the wall, and that hopefully efforts will be made to set this right at some point of time. The other thing that you mentioned was BDs, isn't it so? I think the rationale for the government to reduce the GST on BDs from 28% to 18% comes from a sense of ensuring the welfare of tobacco farmers. But the thing that we as people interested in healthcare should look at is that BDs or smoking tobacco or any forms of tobacco cause high rates of oral cancer. They cause lung cancer. We know the cancer cases in this country have been increasing. So this, I think, is a wrong move. It will have to be corrected at some point. It has in the past been recommended that we shift our tobacco farmers and cultivators and the BD industry to alternative fields, but that hasn't happened yet. So I think this is a significant area of concern, and thanks for pointing it out.
Yes, these are tricky areas, and hopefully a path ahead has to be shown in order to demonstrate that we are taking our healthcare seriously.
It's time now for our expert segment where Dr. Lakshmi Vijayakumar, founder Sneha, a suicide prevention organization, has joined us to talk about the mental health of the youth. She talks about rising instances and the suicides among youngsters. She will also give us tips on how to meaningfully employ certain tactics to keep a healthy mind. We welcome Dr. Lakshmi Vijayakumar, who is the founder of Sneha and who's also a noted psychiatrist. She's very well published and is respected in many quarters. Welcome to our show, Dr. Lakshmi.
Thank you. It's always a pleasure to be with you and the Hindu because you have always supported Sneha. So it's a pleasure and privilege.
Right. So we thought that this September 10th being World Suicide Prevention Day, it will be good to have you on our show, and maybe we can talk a little. So this show basically explains to readers some measures they can take to, protect themselves, their health and their well-being. So I thought we would use this opportunity to talk about the increasing cases of suicide among youngsters, students. My question is it true that there is a real increase in the numbers, or is it a function of reporting? More cases are being reported now, or have the numbers really gone up?
The answer is both. The number of reporting has increased, but there is also definitely an increase in the suicide rates, because rates, we say in 400,000 people, how many people die by suicide. Now, this phenomenon is not only peculiar to India. Actually, if you look at it, about 5 years before, we used to say the 1 million people die by suicide. But last year, the WHO has dropped it down to, we now say about 780,000 people die by suicide. So actually, in the last 5 to 10 years, suicides have reduced in the whole world. But if you disaggregate it by age, many countries have shown an increase in youth suicides. Particularly countries like India and the US have shown an increase in youth suicides in our country. And that is a very we are they have been able to reduce suicides in the elderly in terms of better recognition of depression and treatment of depression, but with youngsters we have not been able to address the issue of youth suicides effectively.
If the numbers among the youth are increasing, what are the stressors that lead to this kind of behavior leading to depression or suicide?
Surprisingly, if you really look at it, we recently published a paper where we looked at suicides between the ages of 14 and 17, no, young people. And what we have found amongst the states in India is that the so-called developed states have higher rates.
Okay.
And that could be an expression because probably with an increased amount of education, there is increased expectation, there is increased expectation from both internally from that youth and from the family. And if those expectations aren't met, then the disappointment becomes more. That is one thing. Globally, if you look at it, there are now studies which are emerging that the more you use the social media, the more suicidal you become. Okay. Particularly, this is true for young girls and young women below the age of 22. But below 23, we find that more and more young women are attempting suicide and dying by suicide. And it is a corresponding increase in the number of, for example, if it for after 2 hours, every 1 hour increase in social media usage increases anxiety, depression by almost 10%. And suicidal behavior becomes almost 2-3 times more. So there is an environmental factor also, which is playing a crucial role in the increasing suicide rates among the young. And the third thing is the fact that apart from social media, increased use of internet itself has found to be related to increased suicidal behavior. What is encouraging about all this is that these are all modifiable factors. These are not like genetic factors over which it's very difficult to do anything. These are all modifiable factors and we can change it and we can reduce. For example, one big study in which has been done in almost 50-60 countries in low middle income countries have found that children who have eat more junk food are more suicidal, whereas children who have at least 1 or 2 fruits or vegetable portions a day are less suicidal. Same way with sodas. The more you consume soda, these are all prospective studies done over about 100,000 children and prospectively studied. And hunger. And this hunger is particularly seems to be associated with suicide in girls. And it is not absolute hunger, but moderate food security. I'll put it that way. Moderate food security, which is more common among girls in low and middle income countries. Where the boys are given preferential meat, preferential food, and the girls get moderate food insecurity. They are at a higher risk of suicide. And the most important thing I would say, particularly for the young people, is sleep. When the night sleep is disturbed, the more and more the sleep is disturbed, the more and more depression and suicide happens. And most of the youngsters are on their gadgets in the night. And that's a major cause for worry. Now, apart from all this, something which is really concerning all of us, everybody, parents, teachers, students, and the whole community, is the amount of cyberbullying which happens. We know that 1/3 of the children are cyberbullied and 1/3 of them are suicidal. And then there are recent study which has been done in low and middle income countries in Southeast Asia and African countries have shown that online sexual abuse is almost 10%, no, 15% in children in our countries. We think that online sexual abuse is more of a problem in the developed countries and not in the developing countries. But this study has been done in about 15 countries in Southeast Asia and Africa. And the prevalence of online sexual abuse is about 15%. I mean, 15% of our youngsters are online sexually bullied, and we are able to trace how the sexual exploitation takes place. First it is contact, and then they are exposed to sexual content, and then they go through a stage which we call as grooming. They groom them, okay, and then they post videos, and then extortion happens and suicide happens.
Right. So this is a very sobering thought. These are some sobering facts, particularly the link with nutrition, the link between suicide and nutrition that seems to be rather, upsetting. But as you said, these are all modifiable risks. What are some of the, I mean, if you were to hand out some practical tips to parents and youngsters, what are some things that they can do mindfully in order to at least safeguard mental health, make sure that they are not depressed? Of course, we are not saying people should treat themselves at home or not go to the specialist when there is a need. But if a child is growing up today, what are some things you would tell the parent or the child itself?
Make sure that everybody in the house deposit their gadget by 9:30, 10, and take it only in the morning. Okay. They have a basket in the room and put all your gadgets at 10 o'clock and take it in the morning. Because night sleep, if you are able to sleep without a gadget, without looking at the gadget, without hearing the pinging noise all the time, your quality of sleep improves. And when your quality of sleep improves, it physically healthy and mentally healthy. The same way, there are lifestyle changes. The other lifestyle change which I would say is to have good, healthy local food, not to go for junk food and colas and things like that. I mean, I'm not saying you avoid it completely, but it can be once in a way. But regular fruits, vegetables, what we traditionally have at home is very, very healthy. And most important, I would say, is make sure that your child or adolescent engages in some physical activity for half an hour. Physical activity increases endorphins, which are natural antidepressants. And if you're able to take care of, see that your child is able to sleep well, eat healthy, and plays, then 50 to 60% of the mental health issues will be sorted out.
Also, I mean, this
And
is
most important is you have to lead by example. Okay.
that's
Most
easier
of the
said than
parents say 9 o'clock, you switch off the phone, but they keep on watching the tablet or the laptop till late in the night. So you have to set an example.
Yeah, that's easier said than done, frankly. But if I may ask one last question, what about schools and educational institutions? How can they equip themselves to handle youngsters who might be depressed or even suicidal?
Yes, schools are the good place to start actually, because uh, if you really look at it, in 10 years there are about 650 million secondary graders in the world. Okay, so they are the persons whom we need to target. Okay, and how we can do that is by threefold. One is that the teachers must be equipped. We have to give them what we call as gatekeeper training, so that the teachers are able to identify a child in distress, learns how to approach them and how to provide support and how to refer if necessary. In fact, in Sneha, we have developed a module which we say look, listen, support, and refer, which we do for all the schools. So, all the school teachers need to be trained in that. In addition, what we need to do is that As what can parents do? Parents also have a sizable role. There are three things which we can do. Uh, the parents have to teach the children how to be resilient. First, what they should not do is compare the child, belittle the child, or thrust their ambitions on the child. So, what they need to do is to build resilience, teach them how to cope with problem solving ability. And third is the most important thing we need to teach particularly the adolescents below the age of 18, 19 is emotional regulation. See, what happens is at that age, their hormones are raging, their limbic system is very active, but at the same time, the forebrain takes 25 years. It is almost 25 years before your inhibitory mechanisms are in place. So they'll not be able to control their emotions. So teaching them small steps to handle their emotions will go a long way in reducing their impulsive behavior, which is suicide is one of them.
Right. Thank you so much for this, Dr. Lakshmi. I'm sure this is one of our, lovely interviews that we've had on the Health Wrap. Thank you so much for coming in and for sharing your views and the facts on the subject.
Thank you. Thank you. Ramya. Thank you very much. It's always a pleasure to talk to you.
I think that we've wrapped up a good amount of important stories for this week, Ramya. Is it time for our fun fact?
Yeah, indeed, Zubeda. This fun fact comes from our trove of fun facts trivia. And did you know that humans can produce enough heat in just 30 minutes to boil half a gallon of water?
Wow, that sounds incredible.
Yeah, the capacity of the human body sometimes, it just amazes us, doesn't it?
Absolutely.
And that's a wrap. Thank you for watching us. You've listened to our expert segment with tips on mental health and the situation in Kerala. Do head over to our health page on the Hindu for more such information. To the left of me is a QR code which you can click to reach the health page. Thank you.